It is morning in Kenya's capital city of Nairobi. The population of over 6 million is awake. More than 320,000 people in total are living with HIV. A recent research conducted by the government puts HIV prevalence nationally at about 6%. At the coastal region, the prevalence is at 8%. Like Nairobi, it is nearly 20% higher among women. The effects of HIV are only compounded by other health issues, including endemic malaria in coastal counties and substantial barriers to accessing essential health services. Since 2011, with funding from USAID, the AIDS Population and Health Integrated Assistance Plus Nairobi Coast project, referred to as Afya Plus Nairobi Coast, has reached millions of marginalized and underserved Kenyans across Nairobi and the coastal counties with high-quality health services. In close partnership with the Government of Kenya, the project strengthened existing health systems and institutions at every level in both public and private sectors to expand access to an integrated package of essential health services, including HIV and AIDS prevention, care and treatment, contraception, maternal, neonatal and child health, and services to prevent and treat malaria and tuberculosis. Today, the results are remarkable. Afya Plus Nairobi Coast has paved the way for significant and sustained improvements in health. The project expanded access to quality integrated HIV services by providing technical assistance, building the capacity of health workers in communities and facilities, ensuring consistent supplies of vital medicines, and mobilizing local leaders to generate demand for services that stop new HIV infections.
One of the ways that we ensured service delivery was through support supervision. We did not just have Afya Plus staff go out to the sites, but they were accompanied by government officials, especially who are related to those particular areas that were providing services. And the purpose was really to ensure that the services that were being provided adhered to the national guidelines and the national standards and protocols that have been set by the government.
Since the project began, over 934,000 pregnant women have been tested for HIV as part of our prevention of mother-to-child transmission services, and more than 199,000 individuals have been tested and connected to integrated care for HIV and tuberculosis. To uphold the right of all Kenyans to make free and informed decisions about their futures, Afya Plus Nairobi Coast expanded access to quality contraception services and information in an integrated manner, offering HIV testing and counseling, maternal and child health, cervical cancer screening, and advancing youth-friendly sexual and reproductive health services. The project also fostered support from community champions, including men.
Tulipotoka kwa training tukaja tukaunda makundi ya male champions. Tukawa tunaingia kwa vijiji kuhamasisha hawa wazee akina baba ili wapatie nafasi akina mama. Mara nyingi huwa ilikuwa ni mzee apende ndio huyo mtoto apelekwe clinic. Tukawa tunahamasisha wazee mara nyingi wawe wanaambatana na akina mama kuwapeleka watoto.
Such statements are heard all over the coast, and in Nairobi it is no different.
Hii upangaji ya uzazi nilianza mwaka jana. Kuna mhudumu wa afya alikuja kwangu akanielezea, nikaenda. Tangu mwaka jana sijaiona mahadhara yoyote.
In Kenya, approximately 1 in every 67 women die from complications in pregnancy and childbirth, and 1 in every 19 children does not survive to age 5. To ensure the safety and well-being of mothers and children, Afya Plus Nairobi Coast partnered with the government to ensure that communities are able to identify danger signs and access quality services in all health facilities, and that providers are equipped with the skills to save lives.
Mama akiwa mjamzito nikaa na yeye mpaka azae, mpaka alee mtoto wake afike mwaka 1.5.
At the community level, we've been able to have new community units. They are basically meant to provide the basic services, and it's a linkage between the community and dispensaries. And then, so at that level, we have community health workers who have been supported through the program from Afya Plus. And then issues of screening for cancers of the reproductive health system.
Marginalized and hard-to-reach groups, including sex workers and others most affected by HIV and AIDS, gained knowledge and skills on a range of vital topics, including improved livelihoods, economic and food security, literacy, sanitation, hygiene, and access to clean water. Over $123,000 was saved through village savings and loan groups to help pay for food, medication, school fees, and business startups.
Wakatuambia tupande mioko inaweza kusaidia. Nilipanda eka moja, ukiwa una mioko, hakuna njaa inaweza kuingia kwa boma yako hata kitoko. Mioko inalingana na nchi kavu kabisa.
Today, nearly 20% of Kenyans ages 15 to 24 have an unmet need for contraception, and 1 in 3 does not have comprehensive knowledge about AIDS.
Youth and adolescents are treated as a cross-cutting theme in the adolescent, youth and sexual reproductive health component. We operationalize the Government of Kenya Youth-Friendly Service policies and guidelines, as well as USAID's Youth Policy of 2012.
Through the project's behavior change initiatives, young people gained the knowledge they needed to form positive lifelong attitudes, values and behaviors around their sexual and reproductive health and rights.
Tukaweza kuonyesha vijana picha ambazo ni za kubadilisha tabia. Kuna ingine ya STIs ambazo tulionyesha pia hapa ili waweze kuona venye hizo madhara yake venye.
We had 6 pregnancies of students. We started to talk about how we can avoid getting pregnant. We taught the girls, and now the number of pregnancies have gone down.
Recognizing that gender inequality and sexual and gender-based violence are significant drivers of poor sexual and reproductive health, Afya Plus Nairobi Coast incorporated gender into all areas. The project engaged women and girls, men and boys, community and religious leaders, health providers, government agencies and development partners to transform harmful gender norms, encourage healthy images of masculinity to address sexual and gender-based violence, and provide legal support to survivors. To date, over 56,700 community health workers have been trained on management, referral, and follow-up on cases of gender-based violence. 600,000 people were reached through community sensitization forums on gender equality and responding to gender-based violence. Led and owned by Kenyans, the Afya Plus Nairobi Coast project has mobilized communities to address key factors like poor sanitation, poverty, nutrition, and gender inequality that restrict people's ability to take control of their health and futures. Through their efforts, hundreds of thousands of Kenyans have transformed their lives and the lives of generations to come.